Okay, good morning, everybody. I'm Marika Walsh. I'm your moderator for the press conference today. We have with us Prime Minister Justin Trudeau and Health Minister Jean-Yves Duclos in Ottawa. Please remember that we will have half the questions in the room and then half the questions on the phone line. We have a total of 25 minutes for questions, and there will be 12 minutes in the room first. We'll go to the Prime Minister now for opening remarks. Thank you.
Merci beaucoup. Bonjour tout le monde, je suis très content d'être ici aujourd'hui, accompagné par notre ministre de la Santé, Jean-Yves Duclos. Our focus continues on keeping Canadians safe, so I have a few updates for you here today. First of all, on treatments. On therapeutics, Monday, Health Canada approved the antiviral Paxlovid. It's an important new tool in our toolkit that will protect against severe outcomes, hospitalization, and death. We have a contract for 1 million courses of treatment. We've received our first shipment, and distribution to provinces and territories are underway. It's important to remember that this will be a powerful tool to continue to keep people from getting extremely sick, but it needs to be used right, and it's not a replacement for getting vaccinated, for wearing masks, for staying safe, for keeping your distance, for doing all the things that need to keep us safe from the beginning. It's just an extra layer of tools that we can use as we move forward through this pandemic. Sur les vaccins et les tests rapides, on a maintenant suffisamment de doses pour que tout le monde puisse se faire vacciner, incluant avec des doses de rappel. Donc, il n'y a plus aucune excuse. Les gens doivent se faire vacciner. C'est comme ça qu'on va passer à travers. Et je vous le rappelle encore une fois, il n'y a aucune gêne d'aller chercher votre première dose. Je peux vous dire que l'infirmier et l'infirmière qui est là pour vous injecter avec votre première dose va être bien plus content de pouvoir vous donner votre première dose, même aujourd'hui, en janvier 2022, que s'il devait être en train de vous traiter dans les soins intensifs. Please remember, we have enough doses for everyone to get vaccinated, to get their booster shots, so go do it. No matter how you may feel that you're late, better late than never. It's never too late to do the right thing. And the health worker who will be helping you get vaccinated would much rather be giving you a vaccine than intubating you in the ICU. So please keep doing what is right. At the same time, we know as we get back to school, as kids are re-engaging, parents are worried about the health of their kids. Therefore, get them vaccinated. The vaccination rate for kids 5 to 12 is too low in Canada, which means not only are kids more vulnerable, but all of society, whether it's teachers, whether it's grandparents, whether it's frontline health workers risking getting overwhelmed when those people start to get sick. We need to do what's right. We need to continue to do the right thing. That means getting our kids vaccinated. It is safe and effective and the right way to get through this pandemic. Another tool, obviously, is rapid tests, which are extremely important during this wave of Omicron. We are purchasing hundreds of millions of rapid tests and sending them to provinces and territories for distribution to Canadians. Getting tested regularly is an important part of how we're going to stay safe. But again, it's no replacement for getting vaccinated, for getting your booster shots, for getting our kids vaccinated. So let's keep doing that. The hardship of this pandemic is felt by small businesses, by workers, by folks across the country in our economy. That's why we're continuing to step up. We made a promise in the beginning of the pandemic to have people's backs, and we have. There are direct income supports for people who lose their jobs or are laid off, but there are also a wage subsidy for businesses to be able to keep people on the payroll so that we can come roaring back quickly when this current wave is done. Keep people tied to their job. These are the kinds of tools that we have that work best. So the wage subsidy, the rent subsidy, the supports we have for people are there to be used. They will be there for all hard-hit businesses through this wave. Please make use of them. The federal government is there to help. Mais on sait très bien aussi qu'avec tout ce qu'on est en train de faire au Canada, l'Omicron en est un exemple, cette pandémie ne finit pas nulle part avant qu'elle soit finie partout. Ça veut dire que nous devons continuer nos efforts à l'international pour assurer de l'accès aux vaccins à travers le monde, accès aux appuis médicaux et aux ressources nécessaires. C'est pour ça que plus tôt aujourd'hui, le ministre Sajjan a souligné le 1 milliard de doses livrées par COVAX aux pays à travers le monde. Le Canada va avoir donné au moins 200 millions de doses avant la fin 2022. Canada is and has been from the very beginning one of the top donors, including global vaccine donors, and has played a leading role within COVAX and the ACT Accelerator and various mechanisms to make sure we are getting vaccines out to the world and supports to be able to get those vaccines into arms around the world. We're also moving forward on specific supports to develop access to vaccines, including, for example, $15 million to South Africa to develop vaccine manufacturing. We will continue to step up, but we also know that other countries must do the same. We'll continue to work with our partners and friends around the world to encourage people to do that. Speaking of international issues, before I finish today, I do want to touch on the situation in Ukraine. Yesterday, I spoke with ministers and the Chief of Defense Staff and a range of officials on an update and a strategy session around Ukraine. Minister Joly joined the call from Ukraine, where she met with President Zelensky and other top officials and reiterated Canada's steadfast support for the people of Ukraine. We are there as friends and allies. We have a military mission there, Operation Unifier, and Minister Anand has been talking about that. We are there to support and train the Ukrainian troops. And we're working with our international partners and colleagues to make it very, very clear that Russian aggression and further incursion into Ukraine is absolutely unacceptable. We are standing there with diplomatic responses, with sanctions, with a full press on the international stage to ensure that Russia respects the people of Ukraine, respects their choice to choose their governments and their direction. We will always be there for the people of Ukraine, and Canada will continue to stand with our allies in defending our friends in Ukraine. Avec le temps froid, avec les tempêtes de neige, avec des journées sombres et courtes, je sais que c'est des moments difficiles pour les gens à travers le pays. On est en train de sortir d'une grosse tempête de neige en Ontario et au Québec. Et je comprends à quel point les gens sont épuisés. Ça a été 2 années extrêmement difficiles et ça continue. On est inquiet pour notre santé, la santé de nos proches, notre économie, nos systèmes de santé. Il y a beaucoup d'anxiété qui pèse sur énormément de gens. Et c'est pour ça que je souligne à quel point c'est important de continuer d'être là les uns pour les autres, d'aider ses voisins, de faire les bonnes choses pour se protéger, mais aussi de veiller les uns sur les autres au niveau de la santé mentale. On a énormément de situations, de crises dans lesquelles les gens sont en train de vivre et nous devons être là les uns pour les autres. C'est pour ça que nous avons lancé récemment l'application Mieux-être pour aider les gens à trouver des soutiens en santé mentale. We've recently launched the new PocketWell app that I encourage you all to download onto your phone. It is an extra tool that the Government of Canada has put together to help people access resources for mental health and wellness, to help people be there for each other, and to make sure that people know that we're going to get through this by leaning on each other and by supporting each other. It's what Canadians always do when we're at our best, and the difficulty of this pandemic has brought out the best of Canadians as we continue to step up for each other. So please, be thoughtful, be engaged, be supportive, listen to people, know that young people are facing real challenges around mental health. The elderly, again, are facing isolation and challenges, and we're all in a time of stress and anxiety. The more we can be there for each other, the better off we'll be as we make it through this. Merci tout le monde. Je suis maintenant très heureux de passer la parole à notre ministre de la Santé. Jean-Yves.
Merci, Monsieur le Premier ministre, et bonjour à tous et à tous. Et avant de commencer, comme le Premier ministre vient de le faire, j'aimerais prendre un moment pour reconnaître la fatigue reliée à la COVID-19 que nous voyons et ressentons tous et toutes partout à travers le pays. Tout le monde ressent les effets des 2 années passées en mode pandémie. Et il n'est donc pas surprenant d'apprendre que la moitié des Canadiens et des Canadiennes rapportent que leur santé mentale s'est détériorée pendant la pandémie, y compris 7 travailleurs sur 10 en milieu de la santé. Et c'est pourquoi la semaine dernière, la collègue, la ministre Bennett, a annoncé une nouvelle application, Mieux-être, qui bonifie le portail Espace Mieux-être Canada. Au moyen de cette application, les Canadiens et les Canadiennes peuvent se connecter plus facilement au portail Espace Mieux-être Canada pour obtenir des séances gratuites et confidentielles avec des travailleurs sociaux, des psychologues et autres professionnels de la santé. En date du 10 janvier 2022, plus de 2 millions de personnes au pays avaient visité le portail Espace Mieux-être Canada lors de presque 6 millions de séances web. Alors que nous réfléchissons à la manière d'aider les Canadiens et les Canadiennes à protéger leur santé mentale pendant la pandémie, nous ne perdons pas de vue que notre lutte contre la vague de COVID-19 sur le pays est une lutte qui est dans un contexte de pandémie déferlante à travers le Canada. Before I begin, let me take a minute to acknowledge, like the Prime Minister just did, that the COVID-19 fatigue is everywhere, and we feel it and see it everywhere in Canada. Everyone is feeling the effects of 2 years of pandemic living. So it's not surprising that nearly half of Canadians reported that their mental health worsened during the pandemic, including 7 out of 10 healthcare workers. That's why last week, my colleague, Minister Bennett, announced a new application, PocketWell, which is a companion app to the Wellness Together Canada portal. Using this app, Canadians can connect seamlessly to the Wellness Together portal for free, confidential virtual sessions with social workers, psychologists, and other healthcare workers. As of January 10, 2022, more than 2 million people across Canada have accessed the Wellness Together portal in almost 6 million web sessions. And while we are thinking of how to help Canadians maintain their mental health during the pandemic, we also remain focused on fighting off the current wave of COVID-19 across the country. Comme vous le savez, Santé Canada a autorisé le traitement antiviral Paxlovid de Pfizer lundi, jetant ainsi les bases de la distribution de ce médicament qui pourrait sauver de nombreuses vies. Le médicament sera employé pour traiter les adultes qui souffrent de symptômes légers à modérés de la COVID-19 et qui sont susceptibles de développer une maladie plus grave. Le Paxlovid est un médicament d'ordonnance sous forme de comprimé. On peut donc le prendre à la maison, ce qui devrait alléger les pressions et les tensions dans nos systèmes de soins de santé. Le Canada a préalablement acheté 1 million de traitements du médicament et le premier envoi de 30 000 traitements sera livré cette semaine à travers le pays en fonction du nombre d'habitants dans les provinces et les territoires. Rappelons qu'un traitement peut soigner une personne. Nous devrions également recevoir un autre lot de 120 000 traitements en février et en mars. As you know, on Monday, Health Canada authorized Pfizer's antiviral treatment called Paxlovid, paving the way for the distribution of this potentially life-saving medication. It will be used to treat adults with mild to moderate COVID-19 who are at high risk of developing a serious disease. Paxlovid is available by prescriptions and comes in pill format, so it can be taken at home. That will ease some of the pressure that we see on healthcare systems. Canada has pre-purchased 1 million treatment courses of this drug, with a first shipment of 30,000 to be distributed this week on a per capita basis. Each treatment course will treat 1 Canadian. We're also expecting another 120,000 treatments in February and March. La nouvelle de ce nouveau médicament est évidemment une très bonne nouvelle pour tous et pour toutes, surtout en ce moment, alors que de nombreux hôpitaux partout au pays vivent une surcharge sévère de cas de COVID. Même si le risque d'hospitalisation est en effet plus faible avec Omicron qu'avec les variants antérieurs, le volume considérable de cas cause une augmentation importante du nombre d'hospitalisations partout au pays. Les prévisions nous indiquent que nous devons donc continuer d'être prudents pour nous protéger, mais aussi protéger nos travailleurs de la santé. Aucun médicament, y compris le Paxlovid, ne peut remplacer la vaccination et les mesures de santé publique. En termes de vaccination, les nouvelles sont encourageantes. 35% des gens admissibles ont reçu une dose de rappel. 48% des enfants de 5 à 11 ans ont reçu une première dose et 78% des Canadiens de tous les âges sont maintenant entièrement vaccinés avec 2 doses. Ceci étant dit, nous devons continuer d'accélérer les efforts de vaccination pour atteindre la vaccination universelle. The Paxlovid announcement is obviously welcome news to Canadians, especially at this time, when many of our country's hospitals are overwhelmed with COVID cases. Based on recent modeling data, we can expect Omicron cases to continue to surge across the country at a very high level while monitoring for a potential peak in the coming weeks. Though the risk of hospitalization is individually lower for Omicron, the sheer volume of cases will likely keep increasing hospital admissions. These forecasts underscore that we must continue to exercise considerable prudence in order to limit the coming surge. No drug, including Paxlovid, is a substitute for vaccination and following public health measures. On the vaccination front, the situation is encouraging at the national level. 35% of all eligible Canadians have now received a booster dose. 48% of children ages 5 to 11 have received their first dose. And 78% of all Canadians of all ages have received their primary 2 doses of vaccination. This being said, we must continue to accelerate our vaccination efforts to trend towards universal coverage. Ceci étant dit, bien que les mesures communautaires soient nécessaires en raison de la flambée rapide des cas, n'oublions pas l'importance des mesures individuelles. Dans les lieux publics, portons un masque, limitons le nombre de personnes avec qui nous sommes en contact. Mais avant tout, faisons-nous vacciner et lorsque nous y sommes admissibles, continuons également à être vaccinés avec une dose de rappel. This being said, while community-level measures are necessary, given the current rapid growth, it cannot overstate the importance of individual practices. Let us continue to wear a mask in public places. Let us continue to limit our contacts. And most importantly, let us get vaccinated. And if eligible, get boosted as well. Merci. Thank you.
Okay, thank you so much. Just a reminder for the journalists who joined us in the room, we will have 12 minutes for questions in the room and then go to the phone line. Please remember that if you ask for French and English translation, you will lose time to ask questions. And if we could keep the answers brief, then we can get to as many questions as possible. The first question will go to Kevin Gallagher, and then it will be Laurence Martin. Please go ahead.
Good morning, Prime Minister. Inflation's really at all-time highs, highest since 1991 for an annual rate. This is putting pressure on prices for food, gasoline, bottom line for businesses, and government spending. And increased government spending during the pandemic certainly has helped fuel these high inflation rates. So what is the government's plan to try and combat it this year?
First of all, through this pandemic, we've had Canadians' backs. We've been there to support them with wage supports for people who lost their jobs, with supports for small businesses, for workers, for families, for seniors. And that's part of why we've been able to make it through this pandemic as well as we have, despite all the tragedy and loss. We will continue to be there because we came into this pandemic one of the best fiscal positions of anyone in the G7, and we continue to have an extremely strong fiscal position. The inflation challenge that the world is facing right now is a global challenge linked to, obviously, this pandemic and the path out of it, but also linked to significant disruptions in supply chains around the world. That's why we're continuing to work to be there to support Canadians. Just last week, I announced that families in Nova Scotia are going to save hundreds of dollars a month as we've reduced childcare fees because of investments we made across the country, and other places like Alberta and Yukon are also seeing significant reductions in those prices for families. We'll continue to move forward on supports in terms of housing, in terms of supports for workers, supports for families, because we recognize that the rising cost of living and the prices of groceries and gas is a real pressure and stressor for many, many families.
So what should we take from that? Is this something that we will anticipate? It sounds like that's more government spending, that's more stimulus, that's more aid for people. But in the 2021 economic and fiscal update, the government seemed to step away from any references to fiscal guardrails or winding down the stimulus spending that came from this pandemic. So what should we make of that? Is this the foreseeable future where inflation rises, but where is the check and balance in terms of the fiscal guardrails and reining in the stimulus spending that was necessary during the pandemic, but is now exacerbating the inflationary situation Canadians find themselves in?
Actually, Kevin, what you'll find when you look at our fiscal projections is an indication that the debt to GDP ratio needs to continue to decrease in this country. And that's something that we've always put forward as a sense of fiscal responsibility, that the size of our debt in relation to the size of our economy needs to continue to decline. And it is doing exactly that. But at the same time, yes, as you point out, we are making the choice to be there to support Canadians, to have their backs, to support seniors, to support families, to support small businesses, to support workers. We're going to continue to be there to support Canadians because we know that helping each other out is not just the best way to get through this medical challenge, this pandemic crisis. It's also the best way to make sure our economy comes roaring back as strongly as possible. And that's actually something we've seen when we were quicker to recover the jobs lost during the pandemic than the United States was, for example. We've seen our economic growth numbers strong, and indeed, we're going to continue to be there to make sure we're supporting Canadians so that, yes, they can handle the challenges around the rising cost of living while at the same time get through this pandemic.
Go ahead, Tom.
Hi, Prime Minister. Tom Perry, CBC. Since the pandemic began, we've seen some politicians facing increasing threats. Their homes are being targeted, their families. What do you think needs to be done to combat that? And do you think that your legislation to protect healthcare workers and patients could be extended to protect decision makers, politicians?
Nobody in the course of doing their job should be faced with threats of violence, threats to their family, and that applies for healthcare workers or for politicians or anyone else. And we recognize that mental health stresses, economic stresses, issues around extremism and protests have created a dynamic where there are more threats to people serving the public than before, whether it's doctors or public health experts or politicians. Our responsibility as a government is to continue to make sure we're keeping all Canadians safe, and that includes people who serve at all levels. And that's why we continue to engage with public security, with police services to ensure that we're doing everything we can to protect Canadians. But we haven't at this point looked at similar legislation. I think the focus on health workers was one that everyone understood was necessary. I think we need to be very thoughtful about how we make sure that everyone else is safe as well.
And on Ukraine, the Ukrainian government has been asking Canada for defensive weapons. And I know that some of our allies, the UK, the US, they have provided weaponry. Others have been reluctant. They don't want to provoke Russia. And I'm wondering what's taking us so long to make a decision. Is it a case where we don't want to antagonize the Russians on this?
I think one of the things that we have seen is that Russia is looking for excuses or reasons to continue and even escalate its aggression against Ukraine. We have been there as part of Operation Unifier, training and supporting Ukrainian soldiers and the Ukrainian military. We've been there with supports in many different ways, and we will continue to be. The decisions that we take will be based on what is best for the people of Ukraine and what is best towards keeping peace globally as long as we possibly can.
Antagonize the Russians? Is that-
We're looking at many different factors when we make decisions on how to best support the people of Ukraine. The bottom line is we will be there to continue supporting the people of Ukraine through multiple levels and layers of support.
Okay, we're going to go to Global News, then Radio-Canada, then we have Canadian Press, then we have the Winnipeg Free Press, and then we have the Star, and we have 5 minutes left.
Hi, Prime Minister. Mercedes Stevenson, Global News. Canadian Special Operations Forces have deployed to Ukraine to look at options for supporting the Ukrainian government, as well as embassy and personnel evacuation if it gets to that point. What are some of the options you're hearing in terms of possible support, and are you concerned about your ability to evacuate that embassy and the Canadian military personnel who are on the ground?
Obviously, we are extremely concerned with the rising aggressive moves by Russia against the Ukrainian people, against Ukraine. And therefore, as an ally and friend to Ukraine, we will be there and continue to be there to support them and to work diplomatically with all of our allies around the world to encourage and insist that Russia not continue its escalation and threats of violence. It is important and responsible that we be planning for multiple contingencies. And while I won't get into operational details, I can tell you that the Canadian Armed Forces, the Canadian Foreign Service, our multilateral partners, we're all looking at a range of possibilities and contingencies to make sure that we are best able to keep people safe and support the Ukrainian people.
Op Unifier is set to expire in March of 2022. You've tasked Minister Anand with re-upping that. Why haven't you already made that commitment, and will you make it here today?
As you well know, for many years we have been supporting Ukrainian military through Operation Unifier, a training mission that involves about 200 Canadian troops there on the ground. I visited them a few years ago to see the great work they were doing. It is a continued commitment that we have, and when there's an announcement to make on extension, we will be making it.
Bonjour, Monsieur Trudeau, Laurence Martin, Radio-Canada. J'essaie de comprendre, est-ce que vous craignez un conflit armé en Ukraine? Et si oui, qu'est-ce que vous attendez pour envoyer des armes?
Oui, nous craignons un conflit armé en Ukraine. Nous sommes extrêmement préoccupés par le positionnement du gouvernement russe, par ce qu'ils sont en train de dire et les envois de soldats sur la frontière avec l'Ukraine. C'est une inquiétude partagée par nos alliés à travers le monde et par le gouvernement ukrainien. C'est pour ça que nous sommes là. Nous allons continuer d'être là en tant qu'alliés et partenaires de l'Ukraine. Nous allons travailler avec nos alliés à travers le monde. Nous allons continuer nos efforts diplomatiques, nos menaces de plus de sanctions sur la Russie, notre appui à l'armée ukrainienne et notre travail pour respecter le libre choix démocratique du peuple ukrainien malgré l'interférence potentielle russe.
Et qu'est-ce que vous attendez pour envoyer des armes dans ce cas-là? Puis sur un autre sujet aussi, sur les tests à l'arrivée pour les athlètes qui vont participer aux Jeux olympiques de Pékin, on comprend qu'ils sont extrêmement sensibles et des gens qui ont contracté la COVID récemment, tests positifs, sont obligés d'être isolés pendant des semaines. Est-ce que vous vous inquiétez que des athlètes canadiens ne puissent pas participer aux Jeux? Est-ce que vous allez intervenir auprès de Pékin à ce sujet? Mais aussi sur l'Ukraine d'abord.
Nous comprenons tout à fait à quel point c'est important de veiller à la santé, la sécurité de tous les athlètes qui participent aux Jeux olympiques à Pékin. C'est pour ça que nous savons évidemment que ça va prendre des mesures de santé, mais nous devons nous assurer aussi que ce soit les bonnes. On veut que nos athlètes canadiens soient protégés d'importation ou d'exposition au virus d'autres athlètes. Donc, c'est bon qu'il y ait des mesures en place, mais s'il y a des préoccupations spécifiques par rapport aux tests, on va faire des suivis.
Okay, the Canadian press will be next, and then we'll go to the phone lines.
Prime Minister Mike Blanchfield, Canadian Press. Following on some of the questions Kevin was asking a moment ago, finance officials said last month that the figures in the fiscal and economic update were based on projections that COVID would be on the wane by April. Now we have Omicron. Is that still the timeline for the government that the government is following, that you view the COVID-19 pandemic becoming endemic? Can you comment on that?
Every step of the way with COVID, we've been preparing for a range of scenarios. Obviously, everyone hopes that it is going to be on the wane. Everyone hopes we're going to be able to get back to all the things we love as quickly as possible. But as we saw with the Omicron wave, it is going to continue to present challenges over the coming times, and we have to be ready to adjust. The one thing that we are steadfast on as a government is we will be there to support Canadians with whatever it takes for as long as it takes. And it's not just about making sure that we're keeping people safe from COVID. It's also, as we saw through the first waves of the pandemic, that being there to support small businesses, workers, families, seniors, young people, is actually not just about supporting the health outcomes, but supporting the jobs and the return to normal of the Canadian economy.
Last week we saw the mix-up on cross-border truckers and vaccine requirements. It took more than 12 hours for the government to correct its position on the vaccination status of American truckers coming in. What happened there, and what impact will this have on the supply chain as Canadians see perhaps fewer groceries on shelves, et cetera?
I'll turn to the health minister for discussion on this, but let me remind people that we have been clear for many, many months, since back in November, that the exemption for truckers to not be vaccinated would be ending in January. We have been consistent on that. There was a miscommunication from an official last week that contradicted that was quickly corrected. But trucking companies and logistic companies have known since November that this was coming. On top of that, the U.S. Is moving forward in the coming days with an identical mandate to ensure that truckers are vaccinated on international travel as well. So we are aligned with them. We know how important it is to ensure the free flow of goods and services and essential produce across the border. This is something that we've been concerned with and attentive to since the very beginning of this pandemic. We shut down the Canada-US border for the first time in history to non-essential travel. But we were able to keep the essential flow of goods, medical supplies, of food flowing back and forth across the border. We did that for well over a year. We will continue to make sure that we are getting what we need in Canada while, as always, putting the safety and health of Canadians as our top priority.
And I will just add that not only was this very clearly stated, but that was the right thing to do. As we all know by now, getting our supply chains operate and sustainable and as risk-free as possible is about protecting the industry, businesses, and the workers. The only way to go through this crisis is to lead to universal vaccination, and that, as I said, is not only the right health policy, but also the right economic policy.
Okay, operator, over to you. Thank you.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de Mélanie Marquis, La Presse. La parole est à vous.
Merci beaucoup. Bonjour, M. Trudeau. Je voudrais faire des suivis sur des questions qui ont été posées par mes collègues. Par rapport à l'Ukraine, d'abord, si un conflit éclate comme tout le monde le redoute, Que fait-on des soldats canadiens qui sont en mission pour l'OTAN en Lettonie et en Ukraine? Est-ce qu'on les ramène au pays si un conflit éclate?
Ben, d'abord, en Lettonie, nous sommes là pour justement défendre les États Lettonie, Lituanie, Estonie et les pays de l'Est de l'Europe d'incursion ou d'agression russe. Et nous allons continuer le travail important que l'OTAN fait pour protéger le front Est de l'OTAN. En Ukraine, nous sommes là pour faire de la formation. Ça fait plusieurs années qu'on est là. Je suis allé visiter il y a 2-3 ans nos soldats sur le terrain qui font une très bonne job de formation pour l'armée ukrainienne. Nous allons prendre des décisions selon la situation, selon les actions qui pourraient être prises par la Russie ou d'autres. Nous avons des plans de contingence pour toutes sortes de différentes options, mais je ne vais pas aller dans le détail de plans opérationnels maintenant.
OK. Puis maintenant, par rapport à la Chine, les Jeux olympiques, je sais que la question vous a été posée, mais est-ce que vous craignez quand même que les athlètes canadiens soient particulièrement ciblés par la Chine, avec qui on a une relation assez tumultueuse en ce moment? Est-ce que c'est une crainte que vous avez parce que la Chine ne se prive pas de viser le Canada? Il a fait récemment en blâmant un paquet du Canada pour l'arrivée du premier cas Omicron à Pékin. Puis d'ailleurs, si vous pouviez réagir aussi à cette allégation-là.
Bien, tout d'abord, j'espère que la Chine va permettre aux Jeux olympiques de se dérouler et aux athlètes de tous les pays, incluant le Canada, d'être à leur meilleur pour pouvoir célébrer ce moment sportif rassembleur à travers le monde qui est très important pour tout le monde. Nous allons toujours être là pour appuyer nos athlètes et nous nous attendons à ce que nos athlètes soient victorieux à bien des moments pendant les Jeux olympiques et nous allons continuer de veiller à ce qu'ils puissent avoir tous les opportunités de réussir. Par rapport aux enjeux diplomatiques, on continue de voir que la Chine cherche à jouer une diplomatie un peu forte avec le Canada et avec d'autres pays. Nous allons continuer de chercher à être fermes dans nos positionnements par rapport aux droits humains, par rapport à la démocratie, par rapport au respect des règles à l'international et la règle de droit. Mais nous allons aussi continuer notre travail à l'international pour créer des opportunités économiques pour tous.
Thank you, merci. The next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Hello, good afternoon, Prime Minister. Your party promised back in 2015 to cut back on the use of consultants. So I'm wondering, how do you explain the fact that spending on outsourcing contracts has increased by more than 40% since then? And how do you explain the sharp increase in federal money flowing to McKinsey since the Liberals formed government?
I think one of the things that we're always looking at is how to make sure we're delivering the best possible services to Canadians, how we're modernizing our functions, how we're supporting the public service with all the best practices and supports for them, and that we can move forward. On that, there is tremendous capacity within the public service, but it is normal and to be expected that we would also need to turn to outside experts for further help on improving the efficiency and the delivery of services to Canadians. We will continue to make sure that we are having Canadians' backs, that we are supporting them, including through unprecedented times of this pandemic, and that is work Canadians expect us to continue to do.
And Prime Minister, do you support the opposition's request for the Auditor General to review the government's outsourcing contracts, particularly as it relates to McKinsey?
The Auditor General does extraordinarily important work in Canada in reviewing and advising governments on how to do even better by serving Canadians. I welcome all the work that she will do in many, many areas to help us continue to serve Canadians as best we possibly can.
Thank you, merci. La prochaine question est de Olivier Ferron-Boissé, TVA Nouvelles. La parole est à vous.
Oui, bonjour. J'aimerais vous entendre sur des données qui ont été publiées par l'Institut national de santé publique du Québec, l'INSPQ, qui rapporte en ce moment que, d'abord, le Canada, dans les 7 derniers jours, est au 5e rang pour le nombre de mortalité, le taux de mortalité par 1 million d'habitants. Le Québec fait la pire figure là, à l'échelle mondiale à ce niveau-là. Selon vous, est-ce que c'est simplement la façon de rapporter les mortalités qui explique ça, ou on parle peut-être de la fragilité des hôpitaux ou encore le plus bas taux de vaccination à la 3e dose en ce moment, notamment au Québec?
Tout d'abord, je veux souligner à quel point c'est important que nous continuions de travailler ensemble les différents paliers de gouvernement. Nous avons été là pour le Québec et pour les Québécois et pour tous les Canadiens avec des investissements sans précédent. 8 $ sur 10 de toute l'aide pendant la pandémie venait directement du gouvernement fédéral. Et quand on parle d'investissement en santé, par-dessus, en plus des 43 milliards de dollars qu'on transfère aux provinces et aux territoires pour les soins de santé à chaque année, on a dépensé 63 milliards de dollars liés à cette pandémie sur des vaccins, sur des transferts additionnels aux provinces pour aider le système de santé. Une des choses qu'on a vues, et vous l'aviez mentionné, Olivier, l'importance d'harmoniser la collecte de données et de pouvoir voir de façon uniforme ou au moins comparable la situation auquel on fait face dans différentes parties du pays pour mieux pouvoir répondre. C'est pour ça que nous sommes en train de parler justement de la collecte des données et des stratégies à ce niveau-là avec les provinces et territoires. Mais aussi, nous devons d'être là pour les provinces qui font face à des crises particulières. Et on sait que cette vague de Micron frappe très fort au Québec et à nos systèmes de santé. Et le gouvernement fédéral va continuer d'être là pour appuyer dans la mesure que c'est nécessaire.
Je poursuivrai sur la commissaire Joanne Castonguay qui a déposé son rapport sur les CHSLD dans la première vague, bon, les nombreux décès, notamment au Québec. J'aimerais vous entendre en réaction là-dessus. On dit que les CHSLD n'étaient pas prêts. Dans le contexte aussi où vous voulez imposer des normes nationales, on est rendu à ce niveau-là dans ce désir de votre gouvernement de justement avoir des standards là, à l'échelle canadienne.
Nos aînés à travers le pays méritent d'avoir les meilleurs soins possibles et c'est exactement pour ça qu'on est en train de travailler avec les provinces pour s'assurer que les soins pour les aînés soient pareils ou soient au même niveau. C'est d'ailleurs quelque chose d'important pour tous les Canadiens, quel que soit où on est dans le pays, qu'on ait les meilleurs soins possibles pour les aînés. Mais je suis très content de passer la parole au ministre de la Santé pour en parler plus.
Merci. Je vais revenir très brièvement à la question antérieure. Au Canada, en raison de cette collaboration à laquelle le premier ministre fait allusion, on a parmi les G7 le meilleur taux de mortalité. On sait que c'est une statistique, ça n'empêche pas d'être évidemment extrêmement triste des nombreux décès que nous avons vus au pays, y compris chez les aînés. Mais parmi tous les pays du G7, nous sommes le deuxième meilleur pays et de loin là, en termes de protection des gens en santé, en particulier en termes du taux de mortalité. Si on avait eu le même taux de mortalité au Canada qu'on a vu aux États-Unis, on aurait multiplié par 3 le nombre de décès qu'on a vu au Canada au cours des 22 derniers mois. Ça, c'est sur la question des taux de mortalité. Sur la question des travaux avec les provinces et les territoires, c'est clair que cette crise a été très, très dure pour les aînés, en particulier au Québec. 80% des décès de la première vague qui se sont passés dans les centres de soins de longue durée. Donc, beaucoup de gens, beaucoup d'aînés qui ont été laissés à eux-mêmes, qui sont morts souvent dans des conditions atroces. Mais la bonne nouvelle, c'est que le gouvernement canadien a pris un engagement durant la campagne et d'ailleurs le fait longtemps avant la campagne de travailler avec les provinces et les territoires pour faire exactement ce que le premier ministre dit, c'est-à-dire de prendre soin de nos aînés, de s'assurer de la sécurité et de la dignité de tous les aînés, peu importe où ils vivent au pays et dans quelles conditions ils peuvent habiter à travers le Canada.
Okay, this will likely be the last question over the phone.
The last question is from Brian Platt from Bloomberg News. Please go ahead.
Hi, Prime Minister. I just wanted to go back to the answers you gave earlier on the inflation rate. And just so I understand, are you saying that despite inflation being at a 30-year high, you are not pulling back on any of the stimulus spending your government has planned over the next few years?
When we put forward our budget a year ago, we included specific stimulus spending to move forward to get out of this pandemic. That continues, but it was stimulus spending that would decrease as the economy picked up again, and we've demonstrated that our concern for fiscal responsibility is continuing to be a priority for us. We will continue to look at a decreasing rate of debt to GDP in this country. We came into this pandemic with one of the best records in terms of our fiscal balance book, and we put that to work in terms of supporting Canadians through this difficult pandemic, both on the health side, but also on the economic recovery side. We're going to continue to make sure that we are keeping Canada's balance books healthy, while at the same time being there to support Canadians, because indeed, supporting Canadians through this crisis, supporting workers, supporting seniors, supporting small businesses, leads to better economic growth and performance once we're through this pandemic.
The other new spending was laid out in your election platform. In the TBO report today, it's estimated that will require a further $50 billion in new spending over the next 4 years. That hasn't been budgeted yet. So again, with a soaring inflation rate, are you not concerned that this new spending might actually hurt the recovery?
We know that this inflation that we're facing right now in the country is part of a global inflation challenge linked to supply chain disruptions, linked to impacts of this global pandemic. But we are continuing to work to support Canadians through this challenge. Families are facing real issues in terms of groceries, in terms of housing, in terms of a range of things, which is why our announcement of historic investments in childcare last year is actually delivering for people in a number of provinces, in Nova Scotia, in Alberta, in Yukon, and other places where they're already seeing cuts in the costs of healthcare, which is helping families to the tune of hundreds of dollars a month. And we're going to continue to work to bring down costs for families in housing, in childcare, in a range of things. These are important things to make sure we're continuing to have Canadians' backs as we promised from the very beginning of the pandemic. Nous sommes évidemment préoccupés par ce phénomène mondial de l'inflation. C'est causé par cette pandémie globale, mais aussi par des problèmes dans les chaînes d'approvisionnement. Nous allons être là pour appuyer, pour aider les familles, que ce soit les familles, les travailleurs, les aînés. Nos ententes sur les garderies à travers le pays, y compris un transfert de 6 milliards de dollars pour le Québec pour créer plus d'espace, vont aider énormément de familles à réduire leurs coûts mensuels. Mais nous allons aussi faire des investissements en logement, des investissements dans les appuis, parce qu'on sait que d'appuyer les gens, c'est la meilleure façon non seulement de passer à travers les pandémies, mais d'avoir une reprise économique qui sera forte pour tout le monde.
Okay, that ends today's press conference. Thank you so much.